My knee problems were quite extensive.
There was no space where the knees go together.
On the inner parts of my knees, I have bone on bone.
It's just totally wore out.
So that's where all the pain was coming from.
It was horrible, really.
Tried to put it out of my mind, but the pain was too great.
I had gone to another doctor for a couple of cortisone shots.
I had my right knee scoped. I didn't feel any relief.
It never got any better, no matter how long I rested it or how much I iced it.
I was just like a cripple.
I was almost an invalid.
I couldn't do your normal daily functions.
I could not run or walk any distance.
I couldn't walk down steps. I had to back down.
Pain became so severe, many times I had to hold on to my friend's shoulder.
I love to garden. That was absolutely out of the question.
In golf, I'd tell them, I said, this done turned into a job. This is not fun anymore.
It made me feel horrible.
It made me feel really old.
I was frustrated and humiliated that I couldn't keep up.
Depression sets in.
I was to the limits of anything other than surgery, total knee replacement.
The total knee replacement is a very major procedure.
I always heard horror stories about knee replacement.
They say the surgery's nothing, it's the recovery and the pain.
And I would probably have more limitations following a total knee replacement.
That's one of the reasons I kind of put it off.
I kept thinking that tomorrow, next week, a month from now, they're going to come out with some new super way to repair these knees than the way they do it now.
All right, some help for your aching knees this morning. Robotic technology is playing a role.
Tonight, an NBC6 exclusive, a revolutionary robotic procedure making it easier to perform the surgery.
While Dr. Martin Roche operates,
Dr. Roche said that there's a new procedure with a robot.
And he explained that the robot can be so much more precise.
And it's a partial knee replacement.
And the fact that it was minimally invasive.
And that the recovery should be very fast.
And that post-operative pain would be decreased considerably.
It was a tremendous difference from having a total knee replacement.
It's gotten to the point now where when I'm seeing a patient in my office and I see their potential candidate, I actually have some excitement because I think this new technology will give him a great result.
Dr. Roche, he laid out the cards for me.
Dr. Roche, he said I was a good candidate.
And he wanted to know if I'd be interested, and I said absolutely.
And before I left, I said to Dr. Roche, okay, let's schedule it.
My stay in the hospital was very short.
The MAKOplasty procedure went extremely well. All I had was one pain pill.
And the nurse said, "Are you sure you don't have any pain?" I said, "I don't have any pain. I would tell you in a second if I had pain."
Dr. Roche was absolutely correct in what he said. The recovery was very fast.
But he never told me I could do it that fast. So I was proud of myself. I really was.
I really cheated, and I walked around without my walker, just using the cane.
For safety purposes, I used it because I was advised to use it, but I really did not need it.
If anybody was looking, I used a walker. If they weren't looking, I didn't use the walker.
My surgery was on a Saturday, and I probably could have gone to work the following Monday, but I decided to take one more day.
I was most surprised that the scar was only 2 inches long. In fact, you can barely even see where it was, right there.
My impression of the whole experience is, why didn't I do it way before?
Because it was so easy.
This is the way to go. There's no reason for anybody to undergo a total knee replacement if it's only one side of the joint.
Since I had MAKOplasty, I got my life back.
My knees feel wonderful, really, really good.
It's been 15 months since I had the surgery, and I feel extremely healthy.
My friends were quite surprised at how rapidly I improved and how quickly I came back into action following the procedure.
I hit a bucket of balls and I came home and I told my wife, I said, "Man, I feel good." You know, I was able to turn, hit the ball, and no pain, and it just felt wonderful, you know.
I like the improvement in my knee. I can do cardio 5 times a week. I'm delighted with the result, absolutely delighted with the result.
Since the surgery, I'm back out there every day with all my flowers, and I'm weeding and pruning everything all by myself, and it feels so good.
Our post-operative results have been consistent, so overall we have a happy group of patients.
I'm very happy with the procedure. I would recommend it to everybody.
I just feel terrific. I really do.
If I ever had to do it to the other knee, I would absolutely go back and have it done.
I tell people, whatever you do, don't wait and suffer and endure all that pain. Go ahead and do it.
Just as true as I'm sitting here, it went that good. It went that good.
Restoring quality of life through innovation. MAKOplasty.